In 3, 2, 1. Hello, everybody. Welcome into another edition of Talking Fitchburg. I'm Jeremy Crosby, and it is Wednesday, July 1st, 2020. Happy July, everybody. And the dog days of summer are here, if you ask me. Yeah, warm temperatures out there. It's one of those where you step outside and instantly you're sweaty. Like, you know, it's warm and humid. And yeah, I want you to be safe as we continue through the warm weather. And the outlook is showing above temperature average as well for a while here. So we're gonna be in it for a while, and that's it's okay by me. Better than thinking of the winter time when it's really cold. So that's when you just got to think about it during these times, and you'll make it through. We do have a busy show for you. We'll get you the latest headlines, including a new order released by Public Health of Dane County and Madison. We'll talk to you about that. We'll be checking in with Fitchburg EMS. Want to replay the interview we did with them last week. Kind of give you an update of both. They had some testing of their own staff of COVID-19, but also just talking generally what's going on in the EMS world. And then we'll check in with your Fitchburg Road construction update, get you the latest on all the projects going on, including one that is completed now. All of those details coming up here in just a little bit of time. But first, we do turn to our headlines, and we're going to turn to that warm weather and a warning here. Heads up, it's been quite warm and humid, and it's not going anywhere into as far as the holiday weekend goes. So if you are out and about, stay cool, stay hydrated, apply sunscreen, and find some shade if you can. Yeah, it's going to be a warm one as we head in the weekend. Andrew and I have shared plenty of safety tips when it comes to heat safety. And the biggest one is, you know, if you're going to be out in the elements, you know, pack plenty of water, plenty of sunscreen. You saw there on the image of the heat stroke versus heat. Boy, I'm drawing a blank now. Exhaustion. Thank you. So yeah, just take it easy and be safe as you head out for the holiday weekend and the next couple of days. I mean, it's just warm. All right, going to the new order released by Public Health of Madison and Dane County. You may have saw this, but effective 8 a.m. on July 2nd, Public Health of Madison and Dane County is issuing order number 7, which limits gatherings and prohibits indoor dining and service at bars. These are some of the items that have changed as part of the order. All indoor gatherings are permitted with 10 individuals or fewer, not including employees. Individuals must maintain physical distancing. All outdoor gatherings are permitted to 25 individuals or fewer, not including employees. Individuals must maintain physical distancing. At restaurants, indoor dining capacity is at 25% of the approved seating capacity levels, and bars may provide takeout. Bars and restaurants are permitted to provide outdoor seating with physical distancing. Past few weeks, it says Dane County has seen a substantial high number of cases after consultation with our contact tracing team. Gatherings and visits to bars and restaurants continue to impact the cases, according to the interviews. And we are acting now immediately, says Janelle, Director of Public Health, Madison and Dane County, to curb this increase in cases and protect the health and safety of our community. So again, that'll be changing and going into the weekend. Different if you're heading to Milwaukee, they're moving forward with their phases. So that might be some competing news out there about what's going on, but you need to pay attention to what's happening right here in Dane County. And those numbers are soaring. So keep practicing that social distancing, keep wearing that face mask, and limit gatherings if you can. All right, Fitchburg Public Library will be expanding their curbside services. It says here, due to the steep increase of COVID-19 cases in Dane County recently, we have chosen not to reopen the library July 6th. Again, the library will not open July 6th as planned. Instead, we're happy to expand our curbside services, same day curbside pickup. Please note that services are subject to change, and you've got the information on your screen. So how do you schedule a pickup? You do that by calling a number and then coming out on the specific days. Curbside is now for same day pickup only. So keep that in mind as well. More information is available on the website. Also, Fitchburg Farmers Market does continue, and it says here the honey is back. That's right. Fitchburg Farmers Market happens on Thursday, July 2nd. There will be a market. Yeah, you'll have honey returning this week along with other great items. Remember to get your pickup order in as well if you are taking advantage of that. All right, that does it for our headlines. Coming up next, we open up the digest. We're checking in with Fitchburg EMS. That's next right here on Talking Fitchburg.
You could be spreading the coronavirus without realizing you have it. So follow guidance from authorities where you live and do your part. It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways to connect. It's also important to limit any social gathering. This advice applies to people of any age, including teens and younger adults. Visit coronavirus.gov for the latest information.
Hola, Julia. ¿Estás lista para tocar con nosotros? Yo tocaré mi clarinete.
Y Alma tocará su tambor.
Tambor ruidoso.
Bueno, ya sabes qué hacer, Julia.
Julia sabe.
Dado el autismo de Julia, los sonidos pueden ser muy fuertes.
Y hace música a su manera.
¡A tocar!
La detección temprana del autismo puede hacer una diferencia de por vida. Conoce más sobre la detección temprana en detecciondeautismo.org.
Welcome back into Talking Fitchburg. Joining me this morning from Fitchburg EMS, your chief of all EMS, Patrick Anderson. Patrick, how you doing today?
I'm good, Jeremy. How are you?
I am doing wonderful. I'm happy that you're here today after you took a pretty good swab last night, so people could see exactly how that goes. How'd that feel?
It was not, it was not as uncomfortable as I thought it was going to be. I think the picture was all over Facebook before I think I even made my way home last night, because I got some friends saying, but a beautiful headshot you got. So there's actually a couple different tests out there. This is one actually by Exact Science, is the one who bought these, or who manufactured these right out of here in Wisconsin. So it wasn't as horrible as, again, I anticipated to be. The early tests had a very, very long swab on it, and we said they were reaching back way, touching the adenoids way back in the back of the throat. This one was not as bad. Deputy Chief Dostalik actually got to administer it for me, so he knew he had to be kind and gentle, but still be effective, or I was gonna put him on some suspension or something like that.
I was thinking that he was gonna, no matter what happens here, there's a good phrase for it that I can't say, but basically, yeah, it was could have been a payback moment.
Yes,
but,
what goes around comes around.
Yeah, he treated it professionally.
He did,
as the staff do. Talk about what last night was about and what Dane County Emergency Management is doing or has been doing this past week with testing first responders.
Sure. So Dane County Executive Joe Parisi, looking out for the first responders as police, fire, and law enforcement throughout Dane County. A few weeks ago, Dane County purchased, I believe it was about 3,500 tests, so that and kind of earmarked those specifically for the first responders in the county. Part of this process of, as you're kind of aware, if you've been following this, or if you haven't known where you've been for the past few months, there's an issue of the community spread that's out there, that we're still seeing a significant number of people who are testing positive, who are asymptomatic, right, showing no symptoms whatsoever, yet they're positive. One of the challenges of those patients, or even would be myself, should I be positive and not know it? As much as I'm wearing my mask, and I'm still going to the grocery store, I still have errands to run, and when I'm going out and about, there's the potential for me to spread that. So again, 25% of the people out there roughly still not showing symptoms, still carrying on their daily lives and spreading this. So the intent was, we have our people, I don't want to call us in that high-risk population, but we are out there dealing with a high-risk population, making sure that we are not spreading it as much as we can. So purchased those tests, gave it to Dane County Emergency Management, and said, here, go test our first responders. So Carrie Meyer, who's the Director of Emergency Management, but we see her pretty significantly out there doing some things, worked with the Dane County EMS chiefs and said, how do we do this? Dane County, their emergency management offices has very limited staff. This testing is actually in the scope of practice for any EMS provider that's out there, from an EMT basic to a paramedic. So worked with us, and we said, rather than creating a similar, like an Alliant Energy Center, right, come to one big place and let's test as many people as we can. Let's take this out to the communities where our responders are at. So she kind of pulled the services out there and said, we will bring this to you. What they came out with was 10 different sites throughout Dane County. where they are bringing a team of a couple of people from Dane County EMS office out with all the supplies, the equipment, and actually some people from Exact Science have been coming out with that as well to observe the testing and kind of working as advisement. This is a nationwide product study for testing that's out there. So yeah, 10 different sites throughout Dane County. Verona hosted one yesterday. We did it out at the Verona Fire Station. That was a third such testing site. The first one was out at McFarland Fire and EMS. And then I believe the second one was out at DeForest. And then, so now we have us, I'm sorry, not DeForest, Wanakee. And we were the third one last night. So we had 15 people show up, but it's open to, again, law enforcement. It's not open to the public, but any police, fire, and EMS who comes in to get tested and to be screened in about roughly 24 to 48 hours. If the test is positive, we'll hear back. If it's negative, we don't hear anything. They don't need to track those. But it's a great screening tool. As we're dealing with that high-risk population, we are still transporting patients who we know have COVID. And there are a handful of patients. We haven't, fortunately, at least in the Fitchburg Verona district, haven't had a lot we didn't know prior to making contact with them that subsequently we found out they did have it, but they're still out there. So it was a great thing for the county executive to do to help first responders a little bit of a peace of mind. This is just, so this was the only, this test for the active disease, the active virus. This is not the antibody test. So that's the blood test that they're still kind of piloting out there. It wasn't that one to say whether you got it or not. And there's still a lot of controversy out there, the efficacy of that test, the reliability of that test. Kind of do some research on it through the CDC. They still haven't kind of nailed that one down yet.
Yeah, it's still coming along. And why is this so important, Patrick, to have these medics get tested? And follow-up question to that would be, if you find out or our medics find out that they had transported a patient with COVID-19, what steps do you take as far as did the medics have to stay off the ambulance for a while? Was there already a lot of protection in place? Kind of break that down for us.
Sure. So I'll start with the importance. Why it's important is that we're the ones out there transporting these patients. If you kind of read who's being affected, currently as of yesterday, the county putting out that the biggest rise they're seeing is the 20 to 30-year-olds out there who are either asymptomatic and with no symptoms or very low symptoms. Now that we're heading into summer and when it's first all popped up there in March, they're flu-like symptoms. So do I have the flu? And that's what many people still had. Do I have the flu or do I just have a cold? Is it allergy? Then we had to cross through the Wisconsin allergy season. It's always going to be something. So we don't know that we have it. The vulnerable population, right? The very young, the very old, the immunocompromised, I shouldn't say very old, right? Those high-risk patients, we call them comorbid factors, who have underlying disease processes. We transport them. So though we've been taking, back to the first part of what you asked, since this kind of came out in March, we were probably a week or 2 weeks ahead of everybody else watching what was coming down the line. We've been taking the proper precautions. It is almost I would have to say, I would hope it is rare that you would see any one of our providers walk in, if you called an ambulance today, walk into your house and not have a surgical mask on. And I think that's just kind of for the foreseeable future, probably way past even our maybe foreseeable future, that's the way it's going to be. We will at least be walking into a home with a surgical mask, a simple mask on. The 911 center asks questions that kind of are still screening patients that are potentially COVID positive, in which case they put that N95 mask on, just offer some better filtration. But we've been doing that since March on every patient, on every call, regardless if you stubbed your toe or whether you're truly coughing up a bunch of sputum out of your lungs. Because it's back to, we just don't know who has them. There's 25% of that population out there who doesn't know they have this. So for our own protection, we're walking into every home with all of that on. Depending on what our treatment plans are, it could just be a simple mask. We're always wearing gloves. Most of it's going to be a mask and eye protection. We have known patients who are positive. We're doing some advanced procedures such as intubating patients, breathing for patients, providing breathing treatments. All of those things, well, each one of those steps increases what we wear. To the potential of you may see them come into your house with a paper gown on, that high filtration mask, a pair of gloves, a pair of eye goggles on. We're in contact. We don't want you to give it to us. And why we're doing this testing. We don't want to give it to our patients, especially because there's a reason we're there. They're kind of that high risk population. Now, ever since March, we've kind of had this, it's stabilized a little bit, but I swear for about 4 weeks ago, there was this moving target of what are we supposed to do if we're exposed? Kind of changed about every 3 days or so, right? Information is. So it's been pretty good. We've been way since March. It's a back to work policy. It uses the what Dane County City of Madison Public Health Department has been phenomenal communicating with all of our first responder agencies, has been taking information, a lot of best practices from the Center for Disease Control, the World Health Organization. So essentially our back to work policy is, it depends on another scale out there, their risk of exposure. So depending on what the patient had, depending on that level of, we call PPE, that personal protective equipment, right? Did you have nothing on, right? I'm hoping I've done enough hand slaps, and I think our responders are very aware that they need to have at a minimum that mask on. If they took all the proper precautions and somebody tests positive, it is self-monitoring, right? You can think of, I'd love to be able to say, you transported somebody who is positive. We want to make sure that you don't transmit, you don't catch it. You need to stay at home for 14 days. And I'm sure every ER doctor and nurse and every engineering person and facilities person at every hospital would love to do the same thing. There would be nobody left in the healthcare system if we took those precautions. So best practice we can do based on shooting the odds there. If you took all the protection you need, that transmission rate is very low. So it is completely self-monitoring. We are still 4 months into this. Every day our crews come in and do a temperature check. Right, check the boxes. I don't have a sore throat. I don't have a headache. Headache is questionable, but right, every day. The headache isn't any worse or better than I have every other day. How about that? But they're coming in and they're doing self-screening. If they have a temperature, they are actually then sent home, or we send them in for testing. So then this is that test for that active, they'll either go to the Aligned Energy Center. Most of them are following up with their primary care physicians. They'll go in for that test. They are actually at home isolated until the results of that test come in, which, and depending on where they're going, has been anywhere from 24 to 48 hours, which has been phenomenal. If they test positive, it is 14 days at home. So really it's this 10-day period, and plus we call it 3 days of fever-free without taking anything to reduce that fever for Tylenol. So really it's this blanket 14 days, right? They are home for 2 weeks. If that test comes back negative, they're back to work as soon as they're feeling better, right? Then they have the flu, they hit something else. So that's kind of the gist of what the complicated back to work procedure is.
No, I'm really glad you shared that, Patrick. It's super important to people to know. I mean, that you day in and day out, the stress level of the staff, knowing that they could be exposed. Every call has got to be treated that way. It's a lot of information, but I think it's good for people to hear that from your standpoint, when the minute you leave the door, it's, and by the time you get back, the protocols that are in place on top of the normal patient care and everything is top notch. And I think it's really good for people to know what you're doing out there.
Yeah, that's great. And our other first responders, hopefully there's not a lot of people watching who are frequent users of our services. If they are, nice to meet you, right? Here's the face to the name. But for anybody who has ever called an ambulance before, or even now, depending on how sick you are, you still may see a police officer, you see a fire engine, in addition to your ambulance, where we're trying to get the right resources, the number of people very quickly to see you. COVID has changed things. We are trying to reduce the number of potential exposures that our responders are exposed to, as you can imagine, especially in the back of a fire apparatus. Anywhere between 4 to 6 people in any one of those fire apparatus in a very tightly confined space. Hopefully not all hacking up along or coughing on each other, but we know this is spread via droplet. They're closer than 6 feet together, right? They have to be in the back of that apparatus. I know they're trying to wear masks, but you can imagine, right? We get one of those people exposed to COVID, the potential for 5 other people or 3 other people to catch this. You've now taken out an entire shift of fire responders. City of Madison, right? Not that it's not important that the City of Madison has 14 stations. The 14 station, City of Madison can take a hit, right? They can take out a station of crews. They have people to fill it. City of Fitchburg does not. City of Verona does not. Many of these volunteer smaller communities absolutely cannot afford to lose 4 to 6 firefighters all in one hit like that. So we're trying to do the same thing with the law enforcement officers, right? Especially with the current events that are going on now with the civil unrest. We can't afford to lose those responders. Absolutely, if they're sick, they stay home. So we try to reduce that exposure. So you may see, right, we've been doing this for months now, you may see that fire apparatus pull up and they stay in their truck. Or the ambulance pulls up and the fire apparatus pulls up and you just see one ambulance provider go in, or you see the 2 ambulance providers go in. We're in radio contact with them saying, this is what I need. Everybody needs to come in. Or in event of a cardiac arrest, we're going. First person there's going in, right? We take the appropriate precautions, but we're going in. Our number one job is to keep people safe. That's what we're going to do. But if it's a low acuity type thing, right? My foot hurts. For whatever reason, you got a fire apparatus. That crew is going to stay outside. So we're going to call them in and say, we'll just reduce the amount of people that are potentially exposed to this, help to reduce that spread that unfortunately we're seeing go back up.
Yeah, no, great information, Patrick, for people, again, to hear what's going behind it. It is amazing. And again, I have a spot in my heart for public safety. So I love the conversation as always. But yeah, thank you so much for talking with us, breaking it down. Stay safe out there. We wish everybody the best in public safety, and keep up the good work out there. All right, Patrick Anderson, your Fitchburg EMS director. We love that guy. Love picking on him too. He's good. All right, we'll take a quick break. You are watching Talking Fitchburg.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Hello, everybody, and welcome into your Fitchburg Road Construction Update. Jeremy Crosby here. We'll get right into the update for this week. And we got some big news as we move through the construction here in the city of Fitchburg. Starting with Fishhackery Road update, traffic at Greenway Cross now uses the new northbound pavement and is scheduled to open in both directions on Monday, July 6th. That's right. As you know it, the concrete on the north side of Greenway Cross has been completed, and the work is progressing as they install curb and sidewalk towards Post Road. Utilities are being completed on the south of Post Road as well. Traffic at Greenway Cross will use the new pavement while crews construct the south half, and we anticipate this stage to last through the July 4th holiday. And then, like I said, hoping to have things open on Monday, maybe happen Tuesday. Can't rule that out. That's all depending on weather and how fast electrical and restoration work all comes together. North of Post Road, we continue to focus on items behind the curb, electrical, sidewalk, and restoration, which will continue for the remainder of this weekend next. As far as traffic closures go, the Greenway Cross will open July 6th or maybe July 7th. Which will also result in Post Road being closed. So as one opens, another one closes. And then they'll switch to the Stage C construction southbound lanes anticipated to happen in mid-July. Yeah, they're moving right along with that. And some milestones here to the project started placing topsoil at the Greenway Cross to UW Credit Union along the Pike Drive, completing all the utility work, water, sanitary, storm sewer this week, installing all the concrete pavement too. And at Greenway Cross, and it's looking good. If you haven't been through there, went through there last night, it's looking good. Looking ahead for construction operations, obviously we saw the Greenway Cross to open on Monday or Tuesday, weather permitting. Then crews will switch to the Stage C construction with the southbound lanes. So you see traffic shifted onto the new northbound lanes by mid-July, and they'll finish up the other side. Greenway Cross to Pike Drive, electrical base, bases and boxes being installed along the terrace, tie concrete driveway aprons together as well as finishing the second half of those driveways, and some topsoil, and beginning the restoration of the restoration after electrical underground is completed. So they'll get that topsoil on there as soon as that's all wrapped up. Pike Drive to Post, completed curb. Complete curb and gutter sidewalks and driveway aprons. Post Road to Bowman Drive, they'll finish placing the base, start curb and gutter, and staging driveways. MG&E utility relocation work will continue. And then as project schedule here, looking ahead, again, Stage A was April 1st through April 19th. Stage B is construction of northbound lane. Traffic shifted to the existing southbound lanes. That lasted through mid-July. Stage C will have the construction southbound. Traffic will shift on the new northbound lanes midsummer to fall. Stage D finishes the medians. Traffic pushed back to the outer perimeters of the lane by late fall. And then with a winter shutdown 2021, we'll have Traceway or McKee to Traceway with a similar sequence. So I think, overall, the project's moving along really well from what I heard from Bill. And again, paving will be happening along Fish Hatchery Road as well to finish up again that construction. So looking forward to keeping you up to date on this stuff, and we'll let you know when the traffic shifts are coming up for that project as well. So very exciting. As far as the McKee Road construction project going, that project is moving forward. There'll be a new traffic switch coming possibly Wednesday of next week. So if you're passing through that construction area, there could be a traffic switch coming by next Wednesday as they continue their work. Seminole Highway will be closed for night 2. I'm giving you the heads up now. They have to run a very deep, from what it's described as, a very deep hole to run some sanitary work through there. And so they'll close that down for one night during the night, and we'll let you know when that's coming up. But keeping in mind that project still moving along. Again, that big footbridge also being constructed and put across McKee Road there, which will allow safer, I guess, crossage of McKee Road, so you don't have to stop. Bikers and pedestrians can move through that area. And again, all of this is part of making that stretch there a lot safer, so better improvements overall. But be aware that traffic shift will be coming, and we'll keep you up to date on that one. Finally, the project that has been my favorite, and that's Fahey Glen. It's open. Looks good. If you haven't been down there, you got the roundabouts between East Sherrill and Lacey. So check that out. Done very well. Came together quickly, and glad that it is open and going. There'll be continued work at Commerce Park Drive and Central Park Place as well. Those projects continue on, and we'll keep you up to date with the new traffic lights on the Highway M and Lacey Road. We'll tell you about that as it gets closer there. For all updates, hit the website, fitchburgwi.gov. And of course, you can stay up through social media as well, through the City of Fitchburg website and the Road Construction Project site.
See on page 4 that the projections need to be flood next Thursday.
Seriously? Thursday? Can't do that.
This is really inconvenient.
I have yoga that day.
I have no time for this.
So.
I can't do Thursday, but I can do Friday.
Disasters don't plan ahead. You can. Talk to your loved ones about how you're going to be ready in an emergency. Don't wait. Communicate.
Welcome back into Talking Fitchburg. Wrapping up the show for the day. I want to thank all of our guests for helping us out with TF each and every day. We certainly appreciate it. As we wrap up here, remember you can stay connected with Fact TV through all of these great resources. That's right. Facebook, YouTube for your social media, over-the-top television. You got Apple TV and Roku Full HD there, by the way. And always at the website, fitchburgwi.gov. All right, that does it for us today. Please stay safe out there. We'll see you tomorrow.